This is Hannah. Hannah is struggling from a disease that has no cure. A disease that makes her legs abnormally long and unproportional, her arms and toes completely out of place, and her face extremely elongated. The majority of patients that have this disease have dislocation of eye lenses and nearsightedness, undue fatigue, shortness of breath, heart palpitations, racing heartbeats, or angina pectoris. Hannah is a Marfan patient.
Marfan syndrome affects three major organs of the body: the heart and circulatory system, bones and muscles, and the eyes. It affects the body's production of fibrillin, which is a protein that is an important part of connective tissue. Fibrillin is the primary component of the microfibrils that allows tissues to stretch repeatedly without weakening. Connective tissue is weaker in patients with Marfan.
3 out of 4 people with Marfan syndrome inherit it from their parents. Other people have a spontaneous mutation which causes Marfan syndrome. People with Marfan syndrome have a 50-50% chance of passing it on to their own children. Marfan syndrome affects males and females equally and is distributed equally amongst races and ethnic groups. The rate of mutation of the fibrillin gene, however, appears to be related to the age of the child's father. Older fathers are more likely to have new mutations appear in chromosome 15. In the United States alone, 50,000 people have Marfan syndrome.
Although there's no cure for Marfan syndrome, the following treatment options have been shown to be quite successful for patients with Marfan syndrome.
Medications can lower blood pressure and reduce the risk of swelling of the aorta. Surgery can repair an aortic aneurysm or replace the thoracic root. And the junction of the heart and aorta if the aneurysm becomes too large.
Just too large.
Imaging of the descending aorta after aortic root surgery is available.
It's available! You hear that? It's available! I know.
There's
Keep
also genetic counseling or testing.
It can be really helpful.
Or both at the same time.
At the same time!
Of diagnosis and when pregnancy is being considered.
You can have a baby!
The issues include confirming the diagnosis and renewing the risk of transmitting
You can renew
Marfan
it.
syndrome
You
to
can
children.
renew it. To children! The little children! Can you believe it? It's great. It's great. So sad.
But there are support groups, the National Marfan Foundation and the American Heart Association.
Good. I'm glad you're getting help, Hannah. It's great, isn't it? Help is good.
Do these things. I don't know how to be nervous.
Go help. Support it. Help all the way. How do you stop that?